Assalamualaikum everyone. Today, we would like to present to all of you about infertility problem in Malaysia. So, hope all of you enjoy our presentation. Our group members consist of 3 kind-hearted girls and also 2 good boys.
So guys, have you ever heard of infertility? Yes, infertility is being common in our country right now. This problem is worrying if it happens continuously. It will affect our country population, and if we do not cure this problem, we sure will have a problem in the future. So, in this video, our group will discuss about factors that lead to infertility problems, the treatment and the procedure to treat the infertility problem and others. So, let's go!
There are many factors that lead to infertility problems. For men, first is sperm production issues, and the second one is blockage in the duct. For women, it can be ovulation disorders and also fallopian tube damage or blockage. There are few factors also that lead to infertility. For example, hormonal imbalance, smoking and alcohol consumption, poor diet, and also abnormally shaped uterus.
So guys, this is the current data for fertility rates in Malaysia from 2012 to 2022. As you can see, the fertility rate in Malaysia at 2012, the fertility rate is 2.2 and slowly decreasing to 1.6 at 2022. So we can conclude that the infertility problem in Malaysia is actually increasing. In 2022, the total fertility rate in Malaysia was approximately 1.6 births per woman aged 15 to 49 years. The total fertility rate refers to the average number of children which would be born to a woman during their reproductive period. So, the infertility problem in our country is actually increasing.
Treatment. The fertility treatment that we choose is in vitro fertilization, widely known as IVF. IVF is a complex series of procedures to conceive pregnancy for people with infertility problems and also a type of assisted reproductive technology. This procedure is used when the female partner's eggs are infertile or unhealthy. There are 6 procedures in IVF. First is ovarian hyperstimulant. Second is egg retrieval. Third is egg and sperm preparation. 4 is egg fertilization. 5 is embryo transfer. And lastly, 6 is pregnancy test. The first step in IVF is taking fertility medications for several months to help your ovary produce several eggs that are mature and ready for fertilization. This is called ovulation induction. Once your ovaries have produced enough mature eggs, your doctor removes the eggs from your body. This procedure is called egg retrieval. Egg retrieval is a minor surgical procedure that's done at your doctor's office or at a fertility clinic. Then, your eggs and sperm are being prepared in lab. In lab, your eggs are mixed with sperm cells from your partner or donor. This is called insemination. Eggs and sperm are stored together in special container and fertilization happens. For sperm that have lower motility, they may be injected directly into the eggs to promote fertilization. About 3 to 5 days of egg retrieval, embryos are being put in your uterus using a thin tube through your cervix into your uterus and insert the embryo directly into your uterus through the tube. Lastly, pregnancy happens if any of the embryos attach to the lining of your uterus. Embryo transfer is done at your doctor's office and usually not painful.
In Surah Ashura, verse 49 to 50, it has stated that IVF procedure is valid in Islam. أعوذ بالله من الشيطان الرجيم لله ملك السماوات والأرض يخلق ما يشاء يهب لمن يشاء إناثا ويهب لمن يشاء الذكور أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير. صدق الله العظيم.
So the fatwa about IVF, Fifth Muzarakah of Fatwa Committee of National Council for Malaysia Islamic Religious Affairs meeting convened on 16th to 17th November 1982, and the Sixth Muzarakah of the Fatwa Committee of National Council convened on 10th October 1983 discussed the test tube babies. Muzarakah has decided that it is permissible for babies born through the help of medical intervention to be a wali and has a right to accept inheritance from their family members. First, the tested baby from the semen of the husband and wife, which then is fertilized respectively, is valid in Islam. Consequently, if the semen and ovum is taken from someone else other than the husband and wife, is invalid. If the semen and ovum from a husband and wife is obtained through means does not contradict with techniques of Islam, then it is considered as a respectable means. Ways to increase fertility. For men, maintain healthy weight. Achieve and maintain a healthy BMI to support optimal hormone levels and sperm production. Next, exercise regularly. Engage in moderate exercise to boost overall health without overtraining, which can negatively impact testosterone levels. Next, limit alcohol and quit smoking. Excessive alcohol intake and smoking can lower sperm count and mortality. Limit alcohol to moderate levels and quit smoking. For women, maintain a healthy weight. A healthy BMI supports regular ovulation and hormonal balance. Both underweight and overweight conditions can affect fertility. Next, regular exercise. Moderate exercise helps maintain a healthy weight and reduce stress. Avoid excessive exercise that can disrupt menstrual cycles. Lastly, avoid harmful substances. Reduce exposure to environmental toxins and avoid smoking, excessive alcohol, and recreational drugs.
So here is the video how does IVF works. So here the ruling on IVF in Islam. Fertility is a disease characterized by the inability to achieve a successful pregnancy based on a patient's medical, sexual, and reproductive history, age, physical findings, diagnostic testing, or any combination of those factors. There are a lot of ways to increase fertility, one of which is achieve and maintain a healthy BMI to support optimal hormone levels and sperm production. On the other hand, we have to engage in moderate exercise to boost overall health without overtraining, which can negatively impact testosterone levels. Moreover, we need to manage stress because it can affect hormone levels and ovulation. Stress-reducing activities like yoga, meditation, and hobbies can be beneficial. Last but not least, we have to eat balanced diet because a nutrient-rich diet with plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats supports reproductive health. Fifth Muzakarah of Fatwa Committee of National Council for Malaysia Islamic Religious Affairs meeting convened on 16 to 17 November 1982, and the sixth Muzakarah of the Fatwa Committee of National Council convened on 10 October 1983 discussed the test tube babies. Muzakarah has decided that test tube baby from the semen of the husband and wife, which then fertilize respectively, is valid in Islam. Consequently, if the semen and ovum is taken from someone else other than a husband and wife, is invalid. To God belongs everything that is in heaven and on earth. He creates what He wills. He gives daughters to whom He wills, and gives sons to whom He wills. That's all from us. Thank you.